Hello there, my name is Erik Martinez. I am a mental health therapist here with Crossroads Behavioral Health in Creston, Iowa. Before that, I myself was a veteran in the U.S. Navy from about 2004 to 2012. I served as a hospital corpsman. Coming to you for Veterans Day 2020, just to try and provide a little bit of background on Veterans Day. Maybe some of you can learn some things you never knew some before about Veterans Day, and also some of the current states of veterans and just mental health in general for the country, maybe even a little bit of the world. So as I said, some background on Veterans Day, because not a lot of people actually know the history of it. So it was originally called Armistice Day in the United States, and it was meant to be a commemoration of the signing of the agreement that ended World War One. It was signed at 11 a.m. on November 11th, 1918, by President Woodrow Wilson. And actually, it was in 1938, on November 11th, that it became a legal holiday by an act of Congress. So, with that background information of understanding where Veterans Day came from, it could be important to look to the future now of what's going on with the current state of veterans. So, as of 2019, there was about 19.2 million veterans in the United States. 1.9 of them are female, 9 million are over the age of 65. A large portion of veterans who served after 9/11, about 40%, had a chance of a service connected disability. That number is actually much higher than veterans from other periods. 30% of active duty and reserve military personnel deployed in Iraq and Afghanistan have a mental health condition requiring treatment. That's approximately about 730,000 men and women, with many experiencing post-traumatic disorder. Less than 50% of returning veterans receive mental health treatment, when actually that number should be probably a lot more. The Veterans Administration reports that approximately 22 veterans die a day by suicide. So, what are some things to keep in mind with all of that history, with all of the facts regarding veterans and mental health? I would say the thing to carry forward is, what are some ways to try and help the veterans that you may encounter in your life? Or one of the things that I always hear from we'll just use the term civilians, people who didn't serve in the military, is how do I thank a veteran? How do I go about approaching a veteran, seeing if there's anything I could do for them? And I would say there's actually some really kind of casual and simple ways to go about that. One, most veterans that I've ever encountered personally, I can't say that this is a fact for all veterans around, tend to feel awkward whenever somebody comes up to them and says thank you for their service. They appreciate it, and of course they're very gracious about it, and they usually feel the warmth from it, but it's always kind of a hard thing to react to. I would also strongly recommend, if you're wanting to engage the veteran about their personal service, ask them for their permission first. Make sure to try and pose it in a sensitive way, trying to be respectful of what they might have done in the military and how you aren't aware of how it may be affecting them. I would also recommend looking into your local veteran communities and seeing if there's anything that you feel called to volunteer with. There's a large amount of communities out there that are centered around either helping veterans or veterans engaging in the communities, trying to give back even more. And I'm sure there are always going to be looking for more help with the things that they do. I would say be a resource and a person the veterans can go to for support. You don't have to have all the answers, but just even being there is a start for them. A lot of veterans will talk about that when they left the military, one of the biggest things that was an adjustment for them was feeling like they left a supportive community. So just going and being somebody who says, hey, look, I'm here, you still have people who want to support you, can go a long way. If you feel called to be more involved, I would say maybe even go and seeking out mental health first aid training or some similar programs that can teach you to be more familiar with someone who may be struggling or may be in danger. Finally, we're going to have a lot of resources here at the end of this video, phone numbers to call from, where I pulled all this information. So if you feel called to do even more research and get even more knowledgeable yourself, that could be a really great way of helping out and reaching out. And as a last tidbit here for any of our the people here local to Creston and the Southwest Iowa region, you might be seeing some of our veterans themselves wearing some of these Crossroads t-shirts that are meant as a way of bringing attention to Veterans Day as well as attention to mental health in general. Around this area, I personally have encountered quite a bit of veterans, so it might be something to keep an eye out for. And again, just a reminder of your local community and the kind of people that you live with and are around, and the different backgrounds that they come from, and the different walks of life, and the different needs that they might have. Thank you for your time.